Hello, I am Dr. Chandrika, practicing as an obstetrician and gynecologist at Chirag Hospital, P Nagar Phase, Bangalore. I also do visit Malati Manipal Hospital, Jayanagar 9th block, Apollo Cradle Hospital, Jayanagar 5th block. I do visit Motherhood Hospital at Banashankari 2nd stage. In normal women also osteoporosis can happen, and why this has taken more importance is in postmenopausal women osteoporosis happens. So the reason for that is hormone change. See, what is osteoporosis? Osteoporosis is nothing but weakening of the bones. See, any bone, it will have some rigid character like this. When osteoporosis happens, it starts becoming very brittle. The bones will start becoming like a sieve. So that is what is called as osteoporosis. What happens is it happens in postmenopausal women, not in routine women, because routine all women are protected from this happening because of the presence of particular hormone called as estrogens, and this is the reason they are protected from so many other causes. See, one thing is they are protected from osteoporosis, another thing is they are protected from getting heart attacks, they are protected from getting cardiac problems because of the occurrence of estrogen in their body. But once the lady becomes postmenopausal, her capacity to produce estrogen is lost. So because of lack of estrogen, all these complications start happening. And that is the reason osteoporosis is more common in postmenopausal women and not in routine women. So postmenopausal women starts getting all these problems once their hormone is not there, that is the estrogen is not there. So when we see this happening, what is the reason we have to be careful? This is supposed to be Osteoporosis Prevention Week. So I want to explain about this one. When osteoporosis happens, why does it matter for you? Because once the osteoporosis happens, I told you that the bone structure will become so thin and it will start becoming like a sieve. It will not be solid. So when it becomes like a sieve, structure becomes more weak. Suppose we have a fall and it will be so brittle, the bones will be so brittle that easily we will start fracturing our bones. And this is the reason for major problems in the elderly ladies. Because of the occurrence of osteoporosis, they land in some fractures, and most important is pelvic fractures that may be life threatening. So that is the reason we have to prevent osteoporosis. So when we want to prevent osteoporosis, what we have to do? We have to provide them with estrogens. That is the thing that you analyze, because when we don't have estrogen, the way to treat it is supplement with estrogens. But when we supplement with estrogens, we will have its own complications also, because they will have severe side effects when we start replacing this hormone. So suppose we unnecessarily start replacement hormones, then they may become prone to so many other cancers, etc. So that is not the answer. So most of the women, when we tell we are going to treat with hormones, they refuse to take it because they have heard all these things. So that is the reason. So one of the reasons of preventing osteoporosis is to make the bone stronger. There is no other better way of making your bone strong than by doing exercise with weight bearing exercise. Your body weight should be borne and you have to do exercise. And the commonest way that you can do that is by walking or running, because in that particular exercises, the bone is having the stress of carrying your body weight and doing the activity. So by doing that, it will be stimulated to become more stronger. So that is the way we can prevent osteoporosis. And there are some supplements, hormone-like supplements, which are there nowadays, which are having a protective effect on the bones. That is one of the way we can prevent osteoporosis. And there are some things called as SERMs, Serum Estrogen Replacement Medicines, because they will act like estrogens but they will not have the side effects of estrogens. So these are the medicines we use to give for postmenopausal ladies to prevent the occurrence of osteoporosis.